Dr. Michael Godfrey is a physician who's been active in the mercury issue for many decades. I first met Dr. Godfrey in 1992 in Germany, the second time that Germany banned amalgam. And he's done further research in his own practice in New Zealand. But Dr. Godfrey's been active in the issue of women's health and overall health for many decades. And he'll even share with you some of his problems with house calls. They still do that in New Zealand, you know. And Dr. Godfrey found that you could take a picture of someone with a thermoscan camera and see the beginning of breast cancer, see the beginning of gum disease. You could see things going on in the human body years before they became apparent with the techniques of the last century. X-rays and compression and mammograms. No, you can look at it much earlier, and he'll show you what happens when you do. You figure out what's wrong and fix it, and the problem goes away. Enjoy the next program. It'll connect the dots for you between oral health and systemic health.
Some 25 years ago, when I was in my mid-40s, I was a standard regular MD in New Zealand, becoming increasingly frustrated by my inability to help patients. And I heard about various organizations in America, one of which was AMPS, that became ACAM. And I think it was in November '85, I first came over to San Francisco and attended the first conference. I never felt more inadequate in that I suddenly realized how little I knew. But also I met a man called Hal Huggins, and for the first time realized that doctors, MDs, need to look at teeth. We're not supposed to look at teeth. The demarcation isn't restricted to building sites. And all of a sudden I started looking at teeth. Now at that time, I also had amalgam fillings myself, and I was also into big game fishing. In New Zealand we have some quite good fishing. And I was eating an enormous amount of big game fish, marlin, tuna, big kingfish. And I was feeling pretty stressed out at times and having bouts of tachycardia, and my short-term memory was getting pretty grim. We still had the quaint customs in those days of house calls, and if I had a house call at 2 in the morning, I knew I had to write down the name and address of the patient before I put my clothes on, and twice I'd forgotten the piece of paper at home, and I had to go back home, pick up the piece of paper, find out where I was going. This was a little bit disconcerting for somebody in their 40s. But when I met Hal and started looking at mercury, I realized that I was hell-bent on poisoning myself. I stopped eating centimeter-thick slices of smoked fish and had my amalgams removed. I bought his book, and one of my patients was the wife of an electrician. I knew pretty well because he used to come fishing with me. And Liz had terrible migraines, usually twice a month on average. I'd have to go to her home with a syringe of pethidine. And she came to see me, and I said, "Hey, let's look inside your mouth, Liz." And sure enough, there was a whole heap of amalgam. So I gave her Hal's book and said, "Read this." She did exactly what you're not supposed to do. She picked up the phone and rang the local dentist and said, "Dick, I want all my fillings taken out." Well, by some incredible divine stroke of good luck, nothing went wrong, and that was the last migraine she's ever had. And this kind of got me hooked on to looking at patients in a different way. And I guess it was just as well that I didn't know what I was embarking on then, or I might have been a bit more reluctant to do it, because it's been an interesting journey over the subsequent 20-plus years. As I've put here, all the regulatory agencies say that there's no problem with amalgam, that the ADA, etc. But you know as well as I do that there is a problem, otherwise you wouldn't be here. Back in '86, a textbook appeared which put me on the right track. Levine and Kidd, talking about oxidation and free radicals. Now, I didn't really know much about, or I didn't know anything about free radicals until I started coming to conferences over here. And this is what we're basically talking about. This is stuff that you know. I'll just quickly go over it. The WHO has told us back in '91 that it's acknowledged heavy metal toxin, and there is no level at which it can be regarded as safe. Has a strong affinity for sulfhydryl bonds, phosphorocarbonyl groups, etc. And Fritz Lorscheider has told us about that, amongst others. It's synergistic with lead and with cadmium and with other metals, including aluminium and zinc. Chemical companies are very careful to only test one product in isolation, but we know we're swimming through a sea of chemicals and toxic heavy metals. In fact, every single one of us, if a fat biopsy was taken and sent to the EPA, would be declared unfit for human consumption. There's no doubt about that. We know that mercury is an accumulative metal. Small doses like arsenic will eventually make you ill. Binds to cell membranes. It depletes glutathione. We know that the whole glutathione selenium complex is involved in our anti-rusting or antioxidant system, keeps us alive. Retention toxicity. I think Boyd is one of the ones, Boyd Haley, one of the ones that started really putting us onto the idea that you have some people that very small doses will accumulate and they retain more than others, and eventually that can make you toxic. And if you look at the normal tests, hair, urine, etc., you won't find it. And the ones where they've got the lowest level in the hair are at highest risk if they're exposed to mercury. One of the bizarre things about mercury that I've found is that in medicine, if you've got somebody who's exposed to a known toxic metal, say arsenic, lead, cadmium, nickel, even copper, you can show they're exposed to it, you can show that they've got symptoms, you can do standard tests to show they've got elevated levels in their body, and then it would be negligent not to treat them. You don't have any problems. You make the diagnosis, you treat them. However, I found that when it's from mercury, from amalgam, all of a sudden these things don't apply. And I've helped several patients try and get claims from insurance companies. We've gone to court. And each time they've been turned down on very clever legal maneuvers. So in the end, I wrote to the National Toxicology Group in New Zealand and said, please give me criteria that are acceptable. Because there are criteria for all the other metals, you must have criteria for mercury. I got a letter back from the top toxicologist, and he said it's very difficult, and he'd like to see evidence of organ damage. Problem is, there's a certain amount of consumer resistance to brain biopsies. They just don't want to know. And that's the fact. It's commercial, it's political, it's financial, but in essence, they don't want to know. And one of the problems is that the symptoms tend to be non-specific, as you well know. Chronic fatigue, depression, short-term memory loss, leading towards senile dementia. And there are a lot of other things. Of course, it affects cardiovascular system, etc. These can be caused by other things. And lawyers are very good at getting so-called experts who can show that this is caused by that, this is caused by that, as well as by mercury, so there's no proof. And I had a lot of patients. Most doctors have a lot of patients in the middle-aged group that have these symptoms. Too many people are not well. We know that too many people aren't well. This paper came out this year in Explore. Some of you may have seen it. Hal Huggins has finally got something published. They did a lymphocyte culture and exposed them to levels of mercury found in the blood of people with amalgam, so-called safe levels. On the fourth day, there was an 80% reduction in viability. This meant that 80% of the lymphocytes were just floating around doing nothing, including in your blood. This would include the natural killer cells and things like that. Now, when the lab does a blood screen, all the white blood cells are dead. Obviously, they've been pickled in alcohol and fixed and stained and stuck on a slide. They assume they were alive when they were in you. But I imported a co-oximeter, second-hand one, from the States some 15 years ago because Hal was doing this routinely. I mean, it's a $20,000 piece of lab equipment. I got one second-hand for $5,000. And I did 30. And in every single one of these, the lymphocyte viability was way down. Sorry, the oxyhemoglobin was way down. And this confirmed that both what Hal was saying, that the oxygen level in the blood is impaired, and also that the lymphocytes are non-viable. This would affect a person's overall health. So we know the major source of mercury is dental amalgam. We know that large numbers are placed every day still in the USA, although I've heard just recently that amalgam placing dentists are in the minority for the first time. This is incredible. 48% now, and dropping, which according to Charlie Brown puts them at increasing risk of malpractice. Great. Now, in New Zealand, in 1968, there was a health department survey of young people, and 21-year-olds at that time had an average of 16 fillings. And I've seen a number that have had 22 fillings, not unusual. And of course, Mark Richardson, his study for Health Canada, showed not only that the average mercury retention was deemed to be 17 micrograms a day, but that some were getting 100 or more. And they based that on 8 amalgam fillings. So the 16 surely must mean that they're potentially being exposed to an intolerable amount of mercury, and we should therefore be looking at the symptoms and signs of chronic exposure to mercury. Now, in 1998, there was an interesting paper published in the New Zealand Dental Journal called 40 Years of Dental Caries by Betty de Liefde. And when I heard this paper was coming out, I got one of my dental colleagues to give me a copy because I was curious as to know how they were going to redefine a memo that went out from the health department to every single dental nurse and dentist in New Zealand in 1976. And this memo said, only drill into teeth showing decay. Strange memo. But 1 year after it came out, there was a 30% reduction in the number of amalgams paid for by the health department, and that dropped to 62% within 5 years. It had nothing to do with fluoride. It meant that 62% were being done prophylactically. Dental nurses especially were drilling into children's sound teeth that had maybe a natural deep groove, making a hole and filling it with amalgam to prevent it getting a hole. It's called prophylactic odontotomy, and that's why there was an average of 16. The problem is that we still have that middle-aged cohort of 1.4 million New Zealanders between the ages of 40 and 70. So that's what they said in that paper. Changes in dental practice were instigated, resulting in a significant reduction, without elaborating on what those changes were. We know that there's a condition called olfactory limbic kindling, where repetitive small doses of especially solvent volatile chemicals can increase the sensitivity of the limbic brain. And that's what the area we're actually looking at. Volatile chemicals, including mercury, has access through the roof of the nose, through the cribriform plate, up retrograde passage up the nerves. It also goes through the mucous membrane of the mouth as well. And of course, this is the area where we have all the trouble. Paper came out in 2003, which I thought was relevant in that it showed severe reductions in metabolism in the hippocampus and mammary bodies, etc. This is the limbic brain in early Alzheimer's, and this reflected limbic dysfunction. And we know from Boyd Haley and others that rats exposed to mercury vapor at levels found in the mouths of people with amalgam just for 2 weeks exhibited this sort of lesions that we find in the Alzheimer brain. And of course there was Diana Echevier's paper with a Poshian in FASEB pointing out much the same thing, memory loss, impairment in logical reasoning, mood swings, irritability, and fatigue. Diagnosis, because we haven't got any acceptable tests for it, rely predominantly on clinical awareness, or cumin. I like that, it's an old term. I found that these patients often have chronic candida problems because the mercury is killing off the commensals in the gut, and candida is mercury resistant. They often have cold hands and feet and tired all the time, and of course different degrees of dementia. These tests, the blood and urine tests, are only relevant for acute exposures, and we have to use provoked or challenge tests, as the potion has shown us. And I also use, I'm fortunate enough that I can use, I've got a Mora, had for 20 years, EAV diagnosis, which helps. So what I started to find was that the symptoms in my patients were the same as the manufacturer's data sheet and the same as what was published in FASEB. But of course toxicity doesn't depend just on exposure. You've got to really look at the person's ability to excrete versus accumulation, and we have to look at, in fact, genetic inheritance. This was the Potion paper that endorsed the use of DMPS. I started using that much the same time and have done probably nearly 1,000 DMPS challenges IV. My first little paper on this came out in '94 in the ACAM journal. We had 80 symptomatic patients. Of course, urine, unprovoked urine, virtually negligible amounts, and then we gave them an IV bolus of 250 milligrams DMPS and checked the next urine, and we had an average of 320 micrograms. Anything over 50 is deemed significant. I persuaded 10 dentists to do the same thing, and I think it's mixed dentists and dental nurses, and their level was 340. They only had an average of 6 fillings compared to an average of 12 in my 80 patients. One of those dentists who was in the same Rotary Club with me, he had a level of 700. And I remember the next week at Rotary, I said to him, "Tony, you've got a hell of a lot of mercury in you." And I remember him thumping the table and saying, "There's nothing wrong with me, Mike, nothing wrong with me, nothing wrong with amalgam," showing a bit of mercurial irritability. Sadly, 5 years later, he had to give up his practice because he was no longer competent. He was shortly after admitted to a nursing home. He died 2 years ago, aged 59, from Alzheimer's. And I then found out that he was one of the staunchest promoters of amalgam, and had in fact joined in a group who had lodged a complaint against me to the Medical Council on the mercury issue. It was rather sad that he suffered the consequences, you might say. Now, thanks to Boyd, when I was over in the States some time ago, and he told us about the relationship between mercury and Alzheimer's. A couple of papers had come out from Duke's University, from Alan Rose's, showing that there was a blood test that could identify people who are at increased risk of early onset Alzheimer's before the age of 70. And this was the ApoE. And ApoE4 from both parents meant that you had a very high risk of getting early onset Alzheimer's. And this is from his 1995 paper, showing that 2% of the population, it's 1 to 2%, have the 4-4, and they have a 70% risk of getting Alzheimer's under the age of 70. If you have a 3-4, about 20% of the population, your risk goes back 10 years. If you have a 3-3, which is most of the population here, you've got to live beyond your 80s. And if you have a 2, you've virtually got no risk. But they said it is a mystery why this happens. And several papers came out over the subsequent years that also said that it was a mystery. One of the papers by Laws and his group looked at sub-Saharan Africans and said, hey, those with 4-4 in Africa don't get Alzheimer's, but those with 4-4 in America do. And could it be something to do with the diet? Well, when our paper came out, which I'll show you in a minute, we said that Africans in sub-Saharan Africa don't get amalgam. They do in America. Boyd Haley showed me why he explained the mystery. And he said it's quite simple if you look at the chemistry, in that the ApoE2 has got cysteine in 2 places. The 3 has got 1 cysteine and 1 arginine, and the 4 has got 2 arginines. And arginine hasn't got the sulfur bonds that combine to mercury. Therefore, looking at the chemistry, one could surmise that if mercury is the underlying cause for the dementia, if you can remove it from the brain as fast as it comes in, you're less likely to get neurological damage. Now, just before I finish, I want to cover what I'm now involved in and have been for the past 5 years, because it's yet another extension of how dentistry is involved. This lady, 53 years old, she had breast cancer, 6 root-filled teeth, 4 of them happened to be on the breast acupuncture meridian. So what are her chances of not getting cancer? She also had amalgams and crown and bridge. And that x-ray was passed by a top dentist and oral surgeon as being okay. But hey, even I can see the problems, plus all the metallurgy. Here's another one, breast cancer, 4 root-filled teeth, 13 amalgams and 3 crowns. Huge problem. I get a patient with an abnormal thermogram that's deteriorating. She's heading towards breast cancer, and they've got that in their mouth. What am I supposed to do? Because it's pretty devastating to the patient to think that I'm going to get breast cancer unless I have all this dealt with. At huge, huge cost, psychological as well. Let me just show you what thermography is. That's a completely normal thermogram, 52-year-old lady, 53 years old, breastfed children, completely normal. Black is cold, then shades of blue, yellow, red. Bit of thyroid problem up there, completely normal. There's a right-sided breast cancer, stands out like a sore thumb. That lady had completely normal mammograms and ultrasounds. In fact, in the end, I went to the radiologist and I said, if this woman hasn't got breast cancer, I'll sell the camera back to America, $40,000. They got a bit worried and sent her for an MRI, and that picked up the cancer. But this is where we can combine the two professions. Completely normal. She happened to be one of my staff. All my staff are female for some reason. And when I got the camera, everybody had thermograms done. 2 years later, I suggested we ought to do them again, and we got a nasty surprise in this nurse. She had a very nasty looking right breast, which was typical, in fact, of a DCIS, a disseminated ductal carcinoma. The nipple temperature had gone right up to over 1 degree, 1.3. So we intervened. We instigated measures which consisted of removal of a root-filled tooth, had to be on breast meridian as well. She had her amalgams removed. She went on vitamin C, selenium, DIM, Mullimen, homeopathic. 3 months later, looking better. 6 months later, looking even better. Nipple temperature down to 0.3, so it's normal. So before March it was that, and 1 year later it was that. Basically by including some dentistry and a few other bits and pieces, but the main thing was dentistry. So we've got a tool here with thermal imaging that can make inroads into the commonest form of cancer in women.